We talked about IPPB on Monday, so we are just going to review the phase variables that are involved with the IPPB today. So this is good base for mechanical ventilation. So let's start with the phases of total cycle time. So you have the beginning of inhalation. You have inhalation. You have end inhalation. And then you have exhalation. So if we remember, let's draw it down here, the infographic that I showed. If we say this is one breath, we have T for trigger, L for limit, C for cycle, and then B down here for baseline. So the beginning of inhalation is going to correlate with trigger. So you are going to set a trigger, and that's also known as sensitivity. So on the IPPB, you're going to set a pressure sensitivity. And remember, the closer to zero that number is, the easier it's going to be for the patient to trigger a breath. So inhalation will correlate with limit. And on the IPPB, we are setting a pressure limit. So the definition of limit is it's a set variable, and in the IPPB's case, it's a set pressure and at a certain place. So we'll set this pressure at a certain place and it keeps it there, but it does not end the breath. So I'm going to put this in a different color. So for limit, we are going to set pressure and it will hold it there. But it's important to know that it does not end the breath. So that's our limit, is inhalation. End inhalation is when the breath cycles off. So this is cycle. Remember, this is cycle here. So that patient will trigger the breath in. It will go up, and once it hits that pressure limit, it will hold it there until we hit the cycle. Now, what differs on the IPPB about cycle than other machines who are delivering pressure, positive pressure to a patient, is it's patient cycled off. So the patient will cycle it off. And what triggers that machine to start exhalation is a change in pressure. So when the pressure changes in the patient circuit, it will cycle off and start going into exhalation. So in our exhalation phase, we are going back to baseline. So baseline is down here. So between each breath, your patient is going to go back to baseline until they trigger that next breath. So let's break it down a little bit further. So the pink line is going to be baseline. So we're going to start with trigger. So trigger. So the trigger, remember, creates inhalation. And as we're going to set a pressure. So we're setting a pressure trigger. And we're going to set it at -1 to -2 centimeters of water pressure. And remember, the closer to 0 or the bigger the number, the easier it's going to be for that patient to trigger a breath for them. So it requires a patient having a work of breathing with the IPPB. So if you decrease sensitivity, you'll increase the pressure. Or if you increase the sensitivity, you'll decrease pressure. So decrease sensitivity. Oops, I didn't spell that right, sorry. So if you decrease sensitivity, you're going to want to make it harder for the patient to trigger a breath. So if it keeps auto-cycling or if the machine keeps trying to pop back into a new breath, you're going to want to decrease the sensitivity. It's too easy for that patient to get a breath. So to decrease it, we're going to increase pressure. Now to increase sensitivity, we're going to decrease the pressure. So the next phase variable is limit. So we'll draw this here, and this is limit. So the limit is going, where is a set pressure, and it's going to keep at set pressure. But it does not end the breath. So it's really important to remember that the limit that you set does not end breath. So this limit is the pressure that we set, and it's going to hold this pressure throughout the whole patient's breath during their treatment. So if we increase pressure, it will typically increase the patient's volume that is given. So an increase in pressure will equal an increase in tidal volume. So we want to start with 10 and then max at 15. Now I know in one of the videos, the resource videos I posted, it has them going up to a pressure of 20. It's gonna always vary based on hospital policy and procedure. And it will also depend on the type of patient that you have. If it has a neuromuscular patient who has super over-compliant lungs, you might need a little bit more pressure to deliver the volume that you need. So the next phase variable is going to be cycle, and cycle ends inhalation. Now on the IPPB, this is patient controlled. So the machine will sense a change in pressure or flow. So that's all you need to know about the cycle with IPPB. So then you go back to baseline. So now we'll talk a little bit about flow rate that we set on the IPPB. So when you set a flow, you're going to start low. So start at a low flow. Because the flow is what determines how fast the patient is getting their breath. So the faster the flow, the faster that patient is going to receive their breath. So if you increase flow, you're going to decrease their I time. If you decrease flow, it's going to take longer to fill the lungs, so you're going to increase their I time. Now, the reason you want to start slow or a lower flow is because you want them to be comfortable, because flow is what you will adjust for your patient's comfort. So some examples of this. So if you have a patient, and let's say they have COPD. So COPD patients are chronic air trappers. So for COPD patients, you want to increase their E time. So you can increase their E time by decreasing their I time, and you can do that by increasing their flow. Now say you have a neuromuscular patient or a patient that's air hungry, that they feel that the breath isn't going fast enough. So, or they're not getting enough big breaths. You're going to want to increase that I time. And by increasing the I time, you're decreasing the E time. And to do that, you are going to decrease the flow.